Hello, today I'm going to chat with you all about going from your breast health to your best health by being your own breast advocate. I actually had a case that I operated on this week, a young lady that was recently diagnosed with a stage 1 breast cancer. This patient had an area in her breast that was non-palpable, meaning she could not feel it. She discovered it on her routine screening mammogram, and on that mammogram, calcifications were seen. So what are calcifications? Calcifications they appear to be like little grains of salt, because that's what they are. It is the salt that the body naturally makes. However, sometimes it can be associated with a very early breast cancer. So usually when these are seen or even noticed is with having a screening mammogram, and that's why early detection does mean better protection, because this is not something that you can often feel on your own. Now, how was she her own advocate? She was her own advocate because she went to get this mammogram done. It showed that the calcifications were indeed present, but it was rated a BI-RADS 3. BI-RADS is breast imaging radiology scoring system, and it's scored on a scale of 0 to 6, with 0 being additional imaging needed to a 6, which is known breast cancer. But typically, the higher the score, usually that denotes that it's a more suspicious mammogram or more suspicious imaging. So BI-RADS 3 is usually my most challenging report, because it means probably benign. Well, I have a problem with the term probably. Is it or is it not a concerning mammogram? And that's the question the patient had, but she did not want to wait to find out. So although they recommended 6 months, she said, you know what, I really need to have this evaluated sooner. My mother was diagnosed with breast cancer recently. My sister was diagnosed with breast cancer 2 years ago, and I want to have this looked up before 6 months. So she came to me, and I agreed, yes, you absolutely need to have this evaluated a little bit sooner. Does these calcifications look like the ones that are probably benign? Yes. However, you cannot make a decision based on just looking at imaging in the dark. You've got to have the patient come in, know the family history, and put that imaging in the context. So in her context of having a family history of breast cancer, it was imperative that she not wait 6 months, but go ahead and have this followed up. So they obliged, and she was able to get the imaging done sooner in terms of her diagnostic imaging. Diagnostic imaging, what is that? It's when there's something that we're attempting to diagnose because there's something seen on screening that is concerning. Diagnostic imaging is just that second look to see, hey, is this real? Is this reproducible? Or is this just an overlap of breast tissue? So on her diagnostic imaging, it did confirm that yes, indeed, these calcifications are here. Although they're faint, they are present. She further advocated on her own behalf because in an attempt to do the biopsy, it was difficult for them to safely access the area because it was very difficult to see since the calcifications were so faint or barely present. And she said, hey, I go to another facility. I'm willing to do that where they can access the calcifications a little bit better, using better equipment. And that's what was done. And I share with her, listen, if they can't access these lesions, just know I can do your biopsy myself surgically. And so they were able to capture the lesion, and it indeed was a breast cancer. Now, it was a stage 1 breast cancer, which is considered a very early stage. The stages go from 0 to 4, with 0 being the lowest stage and 4 being the highest. So it was definitely a win there, because again, early detection means better protection. And because it was seen and found, diagnosed pretty early, I did her surgery right away this week. She's gonna hopefully have an amazing outcome. However, many women aren't aware that, listen, it's okay to get a second or even a third opinion to get the answers that you need if you don't feel comfortable with what is presented. And the imaging centers, they have to go by national guidelines. So I'm not suggesting that what they shared with her was wrong, because in all fairness, when I reviewed the imaging, I agree that they look faint. They definitely appear to be the type of calcifications that can be safely watched in 6 months. However, when it comes to breast cancer, especially if you have a family history, you can't watch, wait, or wonder. You've got to pull the trigger and have it evaluated sooner. And if you can't find someone that's willing to do that, always be your own advocate and seek out a second or a third opinion to get those answers. So I'm hoping this this video is helpful. Again, it's just encouraging you to go from your breast health to your best health by being your own advocate, even when it comes to getting your screening mammogram, your diagnostic mammograms, and biopsies, and on to your surgery and treatment. So if it doesn't feel right, if you feel anxious or concerned in spite of normal imaging, in spite of what appears to be a benign area, make sure you are aggressive and you have someone look into that. Talk to you soon. Again, you can find me at draprilspencer.com and at Dr. April Spencer on Instagram, and TaylorMade Cosmetics as well, TaylorMadeCosmetics.online. But I appreciate you all tuning in, and I hope this was a helpful video for you. I hope you've been inspired and empowered to go from your breast health to your best health.